everyone, Kelsey here. I'm with my friend Debbie, who's going to help me demonstrate some of our exercises for our knee prehab. So to start off, we're going to do what's called quad setting. It basically is going to help us straighten our knees after surgery. So you can use a towel. It can be any sort of towel in your house, or if you have a ball or something else you would rather use. I'm going to give this to Debbie here so she can show how. She's going to put it right under her knee. And yeah, there we go. So what she's going to do now is she's going to use her quad muscle, which is the muscle on the front of your thigh, and she's just going to contract it to try to straighten that leg out as much as she can, pushing down onto the towel, seeing if we can get that foot to where it's almost slightly lifting off the ground. She's going to hold that quad contraction, try to not let it waver for about 10 seconds at the start, and we're going to try to work that up gradually to 30 seconds on each leg. So once she's done on that leg, she's going to switch to the other leg and do the same thing. For exercise number 2, we are going to work what's called our adductors and abductors. So they're the muscles on the inside and outside of your quad and hip. So we're going to do adductors first. Debbie has nicely put her feet bent flat on the floor at an angle that's going to work for her. She's going to take the ball, put it between her knees, and she's going to contract the muscles on the inside of her thighs to squeeze that ball. Again, she's going to try to squeeze it to an appropriate tension and hold that tension the same for the whole 10 seconds, working up gradually to 30 when she is able. And then I'm going to give her a band here to do the opposite. So these are called abductors. She's going to wrap the band around both legs. She's going to make sure the band's around her thighs, so it is important that it's not right on the sides of your knees. You want it to be down around your thighs. She's going to have her feet a little bit closer together if she needs to, just to get that range of motion, and she's going to very nice and controlled open and close her knees. That's going to work the muscles right down along here. She's going to make sure that her upper body's in a nice neutral position. You never want your back to be arching off of the mat for this one. So if you think about tightening your belly a little bit, just make sure that you're not compensating with any other muscle groups. All right, and from there we're going to lead into what's called a bridge. So a bridge is a really good one for the hamstrings running along the back of your thighs. She is going to stay in the same position the last 2 exercises we're in. She's going to press into her whole feet with emphasis on her heels and lift herself up using the back of her hamstrings, her bum, and her belly to help, again, keep that back from overarching or wavering. Her feet are roughly hip width apart, and then once she's held it there, she can bring herself back down, nice and controlled. So then you just continue, so she's just going to continue going all the way up, full range of motion, coming back down, and that would be 1 repetition. So for this one, we're going to do 8 to 15 repetitions as you can, again, working within your pain tolerance. So all the way up, all the way down. When she gets to 8 or 10, whenever it feels like the last couple she really feels her muscles working, she's going to stop. The next one we're going to do in a chair, so you can go and find a chair now, and we'll meet you back here. All right, our next exercise, you have a couple options. So you can do seated or standing heel raises. So what Debbie's going to do is she's going to sit nice and tall in her chair. She's off of the back of the chair using her core and her back muscles to keep her nice and tall. And then she is just going to lift her heels up off the ground using her calf muscles and then coming back down. So that would be the easier version of this if you are someone that does have a lot of joint pain, and this is the place to start. So it would just be seated. She's just going to keep going up and down, and she's going to do 8 to 15 repetitions again. And then when that gets too easy, you gradually progress onto more steps. And the standing version of our heel raises, you're going to want to make sure that you're beside something just in case you need it for balance. So whether it's a counter or a railing or a wall, anything that you have available to you. She's just going to be doing the same thing, coming up onto her toes, making sure her hips come straight up in the air, trying to not be too far forward and rocking like many of you will want to do at home. And working those calf muscles again. So this is where you should feel that one, making sure that you're nice and tight through the belly. All right, these next 4 exercises that we're going to do are all what we consider range of motion or flexibility stretching exercises. So you can do these next 4 every day if you would like. Sometimes it can even help with your pain tolerance and helping relieve some of that pain. So the first one that Debbie's going to show us here is going to be an extension and a flexion. So this is a range of motion exercise. So she's trying to extend her leg out as far as she can go, working on those quad setters that we already did earlier today. And then she's going to try to flex it underneath the chair as far as she can. Yeah, to get that full range of motion, extension and flexion. It is helpful if you have a bit of a taller chair for this one, or a stool, something that you can get your leg right underneath. But you can always sit on a pillow or do something else like that if you're finding that your chair is a little bit too short. The next one is going to be a hamstring stretch. So it's going to stretch out the muscle at the back of your leg again. So the ones we were working with our bridge exercise earlier. So she's going to have her heel down, her toe up, make sure that leg is as straight as she can go comfortably, nice and tall through the upper body, and then her chest is going to come down towards her toe. Your hand can slide down your leg. You want to make sure you're not allowing yourself to roll a lot through the upper body, because that'll take away from the stretch. Stay as tall and open as you can through your chest, and then that's really what's going to get that nice, easy stretch through that hamstring. Again, stretches should only be gentle. You don't want to make them hurt. And then both legs, as always, with every exercise we've done today, what you do to one side, you do to the other. And for stretches, hold 15 to 20 seconds at the start. Whatever you're able to do, work your way up. Our next exercise is just a one leg balance. So it's going to work on your guys' balance, which really you will need after your surgeries. So Debbie is going to find herself next to something she's able to hold on to. Again, whether it's a counter, a railing, even a wall. She's just going to stand on one leg, use all her muscles to keep herself nice and straight. You really want to try to avoid the whole dropping your hip, having that knee coming in. You want to stay nice and straight, and then she's just going to balance. Her hand's going to be over that railing in case she needs it, but gradually you want to work to where you don't need to hold on. And you can count for a certain amount on either side. We'd recommend starting at 10 seconds, working your way up to 30, and then switching legs and doing the same on the other. Our final range of motion exercise for level 1 of our knee prehab is just going to be a passive knee flexion. So this is going to really help you guys out when you're after your surgery and you're trying to regain that range of motion in that knee. You're going to find a band or a towel or something else you can wrap around your shin here. And like Debbie is doing, you're going to just use your arms to pull and let that heel slide across the mat or the floor or the bed, whatever you're on, bringing it as close as you can to your bum comfortably, and then you're going to let it come back out nice and easy. So some of you might have really tight joints, you might not be able to get this far at the beginning, but you just go to wherever you can within your pain tolerance at the start, and then hopefully as you do this every day, which you are allowed to do it every day, you will gradually increase that range of motion in your knee. And again, what you do to one side, always do to the other. And you can do this one about 8 to 15 times as well if your joint is allowing it and your pain is allowing it.
We hope you have enjoyed this level. If you feel ready, you can move on to the next level.
If you are getting ready for surgery, we wish you the best of luck, and we hope that our videos have helped.
And remember, consistency is key, and don't overdo it.